Typically, the postoperative pain can be managed with taking Tylenol or Advil or some sort of NSAID that helps with controlling the pain. If there's also swelling in the area, you can place an ice pack on the area to help reduce the swelling. In severe conditions or severe pain problems, you can reach out to me or to my team or nurse to provide you with a stronger pain medication. A local wound care and dressing of the area is advised. Oftentimes we ask you to apply a bacitracin cream twice a day to act as a barrier between the outside and the incision itself. That's really important to care for that incision because that's important for your healing in the long run. As soon as you feel comfortable with manipulating the pump in the scrotum, you start kind of pulling downward on the pump that allow the tissue inside of your scrotum to become more adjustable and more modifying to the placement of the pump. That will ease off over time, and that will day by day will become easy to operate and use.
This question may not.
If the pain medication giving you constipation, we oftentimes tell the patient to drink a lot of water, eat vegetables and fruit, adding also laxatives, over-the-counter laxatives, or source softeners can help with managing constipation postoperatively. I typically tell my patient to avoid heavy lifting, more than 8 pounds for the next 4 to 6 weeks till they heal. The reason being is that because we worry about herniation of some parts of the device into places that's not desired. So having a light duties for the next 4 to 6 weeks is essential. Depending on your job, if you are using or in an office job, a virtual job, I think you can go back to work as soon as you can. But if you are in a heavy duty job that requires lifting, that probably need more time to recover. Typically you can go back to work as soon as you feel comfortable with your recovery. The recovery period depends on your healing process after the procedure. Typically a patient requires 3 to 7 days to recover. Take it easy. You can be at home watching TV, doing a light walking activities around the house. That's very desirable. But ultimately, you start kind of feeling the parts of the implant by the 3rd or 4th week and able to use the pump, manipulating the pump, and also pulling down to allow it to sit better inside your scrotum. And then you'll be able to use it by the 3rd and 4th week. If you're having any fevers or chills or shaking chills, rigors, we call it, or severe pain, severe swelling in the scrotum, you need to call me right away because at that point I need to see you, evaluate you, and maybe do some x-rays to establish that you don't have anything serious. You'll be seen about 2 weeks for a wound check in the clinic. And then after that, in about 4th week, you come back for cycling of the device, meaning we're going to teach you how to use the pump in the scrotum to inflate and deflate the penile implant. Within the 3 to 4 weeks post-operatively, you'll be able to use the device. We'll provide you with all the numbers and contacts with my nurse and my team in the hospital.